Dr. Michael Lim. He's a cardiologist, and he's cardiology director of St. Louis University Hospital and a Michigan grad. Good morning, Dr. Michael Lim.
Good morning.
There was a new study out about heart disease recently. What did it say?
Exciting study, actually, because it really looked at the causes and the potential avoidance of death from cardiovascular disease. So we're talking about death from heart attacks, death from heart-related diseases, death from stroke.
Right.
And big picture standpoint, about half of all the deaths in this country are preventable by just controlling simple things that we all know about. Stopping smoking, controlling your weight, controlling your blood pressure, controlling your cholesterol, and controlling diabetes.
Half?
Half.
And
that cardiovascular disease still is the number one killer of all people in this country, as well as the state of Missouri. So this is a very local topic.
Okay, so in terms of heart disease, half of it is preventable?
Potentially preventable.
Okay, which means you exercise a little more, you lose a little weight, you eat a little more healthy, you quit smoking.
Well, the biggest thing with respect to those five, the biggest single contributor was smoking. Second was controlling blood pressure.
Okay.
And then third was obesity, or being overweight.
That's the national study. What did the study say about Missouri?
So Missouri they broke it up in terms of rankings, so 1 through 4, 1 being the lowest rates of these things within the country and 4 being the highest. Mm-hmm. Missouri shows the highest rates of smoking and the highest rates of obesity. And so they did an analysis, and so they plugged the numbers into the computer and they spit them out and basically said if the state of Missouri could get a smoking rate down to the state of California, which is amongst the lowest smoking rates in the country, there would be a 6-fold decrease in cardiovascular deaths in the state.
Wow.
6-fold.
Wow. California has a very high cigarette tax. Missouri has a very low cigarette tax.
One of the lowest in the country.
Does that correlate to the amount and the percentage of people who smoke?
You know, there are studies that suggest that there's a price point where you can get people to quit smoking. I think it's got to be broader than that, and this is more complex than just trying to set a dollar amount so that you prevent people from smoking.
Right. But the people in California aren't that much different than the people here in Missouri. I mean, we're all access to the same information. We have access to all the same whatever, right? We're the same people. So why is California so much healthier than Missouri?
There are, of course, always been regional differences in this country with respect to what we do, and how we perceive ourselves in health. And there's always been regional differences, some of which are genetic based on the type of different genetic mixes that are in different regions. It's very obvious to me a long time ago, maybe 20-some years ago, flying out to a heart meeting in California at an airport here in the Midwest, and looking at people walking around and looking at their weight and what they're doing within the airport, get off the plane in Los Angeles International Airport and don't see any of those people.
Right. No, you're right.
And they're on the beach, they're on the streets, they're walking, they're jogging. You know, the weather maybe increases it, and of course it's been raining here for the past 172 days.
There's no question that it's a lifestyle, it's a choice. But is there anything that the state of Missouri can do, the community at large, to sort of push people in the direction of being healthy?
Yeah, I think it's a tricky slope, right? Do we legislate social behavior? And I think there's a lot of people that say absolutely not. You know, these are things that are somebody's personal responsibility, and we shouldn't get into that. But then there's another concept, and we look at a 6-fold decrease in death rates, and there's a lot of costs associated with that 6-fold change, where we could save a lot of money.
Right.
So that might spurn on a concept of maybe we should take on more.
Because the healthier the population is, the less it costs to keep them healthy.
Absolutely. We spend, and study after study has shown this, we spend the vast majority of healthcare dollars at the end of life. And the people who really preach prevention, and this study kind of begs that concept. If you spent a fraction of the amount of money on prevention type things, we would save so much money on the back end.
Right.
And so what's the right thing? I don't think I'm a big fan of trying to increase that price point for tobacco, but smoking cessation programs and other ways to try to encourage people to do the right thing,
Right.
Those are things that theoretically should be working a lot better than they are.
So I've had my struggles. I smoked. I quit smoking. I quit smoking 10 plus years ago. I chewed the gum for a while, and I finally did it. There was no amount of smoking cessation program that would have gotten me to quit until I was ready to quit. And then when I was ready to quit, I bit the bullet and started paying the exorbitant costs of the gum to sort of lessen the effects of withdrawal from the nicotine.
Absolutely. So I firmly believe that almost everybody who smokes, there's no concept in their minds that this is good.
Right.
I think everybody knows somewhere deep inside, or more than that,
Right.
this is not a good thing.
Right.
I shouldn't be doing this.
But it's a question of what's going to motivate you to quit smoking. Cancer is certainly not, right? I mean, they've tried to scare smokers. They've tried to raise the taxes on smokers. They've tried to do everything, warning labels. But if you're going to smoke, it's an internal thing.
So I look at it differently, and this is just a personal thing. I think we all have sort of a responsibility to ourselves and our loved ones and our family. And there are things that we can control in life, and then God knows we see all the things on a daily basis as things we can't control.
Mm-hmm.
At the end of every day, you get a chance to look yourself in the mirror and you say, did I do everything today that helps me be around and puts me in the best state to be around for my kids, my family, do what I need to do?
Right.
Did I do the best I could do?
Yeah.
And that doesn't mean you're perfect, because there's no such thing as perfect. Did I do the best I could do? And that kind of morphs into trying to take smaller steps. So if you smoke a pack of cigarettes and you say, I'm trying to quit, well, smoke less than a pack of cigarettes. Just take little baby steps and start working toward that point in time where you're smoking 3 a day. It's a heck of a lot easier to stop smoking 3 cigarettes a day than
Right.
a pack or a pack and a half a day.
Dr. Michael Lim, our guest, the cardiology director of St. Louis University Hospital, talking about a brand new study that says that Missouri is dead last, the worst of the worst, when it comes to cardiovascular disease, smoking rates, obesity rates. What else was it?
High blood pressure.
High blood pressure. Anything else in that toxic soup?
No, those are our worst.
Those are the big ones.
Yeah.
Okay. So Pete, so you have diabetes. You go to the doctor. The doctor gives you medicine to treat your diabetes so you can go out and continue to do bad things to your body.
Well, you could talk about the same thing in terms of smoking, what we were just doing.
Right.
Those are medicines that
Right.
potentially help
Right.
you do that.
I'm not critical of the doctors.
Yep,
I'm just
no,
saying,
I
though,
understand.
I mean, it's...
High blood pressure, same thing.
Right.
High cholesterol, same thing. And it's really, I think, a different thing. You want to, the whole best practice here is to embrace the concept that something's got to change.
Right.
So the best practice isn't, well, I'm on this medicine to lower my sugars so I can not necessarily change my diet.
Right.
And so I'm okay. I'm on this medicine to lower my blood pressure, but the diet thing, it's okay. The
Right.
deal with high cholesterol, the deal with high blood pressure and diabetes is it's a multi-front battle. It is something that involves taking medicines every day, which is hard and expensive and a pain. It does also involve lifestyle. It does involve somebody to be more active and exercise more, and that'll improve sugar levels, that'll improve weight, that'll improve blood pressure levels, and it involves not eating the same kind of things, because what we eat tremendously impacts those diseases.
That is Dr. Michael Lim. Pretty sobering study when you get right down to it. I mean, it is a canary in the coal mine type of study.
It is, if you look at it in terms of, wow, look at all these deaths that occur in Missouri from cardiovascular disease, or look at all these deaths that occur in the country. But it's the blueprint for the canary to keep living in the coal mine, because the canary can look at it and say, hey, if I can get off cigarettes, or if I take these medicines and I get rid of the salt in my diet, and my blood pressure comes down to 125/78, I can live.
Right. I had a doctor recently tell me that, well, I don't have time for that, but Dr. Michael Lim, cardiology director of St. Louis University Hospital, you're always welcome here, even though you're a Michigan fan. We will not hold that against you. Doctor, thanks for coming in.
Thanks, McGraw.
You got it. 9:33 here, Big 550.